Dr. Bray, thank you for being with us.
Pleasure. It's good to be here.
Are you having a good time here in Barcelona?
It's so great. I've traveled from British summer to actual summer. It's so nice. And this clinic is fantastic. Amazing, this clinic. To have 30 inpatient rooms, all the staff are so hospitable. It's clean, it's beautiful. And I've been to probably 20 countries lecturing and live surgery and cadaver dissections. I've never seen a place with its own auditorium and congress hall, so I congratulate you.
Well, thank you very much. That's great. Why did you specialize in face, in the eyes and facelifting and all this? What did you find there?
The face is the expression. It's how we communicate, we interact with people. It's technically interesting surgery, it's interesting anatomy, and there's nowhere to hide in the face. You do rest of body aesthetic surgery, they've got clothes on. In the face, there's nowhere to hide. So you have to be very, very meticulous. You have to be very considered in how you treat people.
I was thinking, I've interviewed many surgeons, plastic surgeons during this years, and I found that the mix between the technique, the surgery technique, and the craftsmanship, the art, is amazing, isn't it?
I've just finished lecturing on this. This is one of my big things. Surgeons generally are very left-brained creatures. The left brain is logical, analytical, ordered. The creative side gets lost in that. The genius, the creativity, the intuition, the artistry. But a great aesthetic facial surgeon needs to have both sides. So you need that technical ability, the logical brain, the mathematical function that is going to look at vectors and tension, anatomy and risks. But you need the creative side as well. You have to have good taste. You have to know what is attractive.
So what do you tell a patient when they come into you and when to see you the first time and they ask for things, of course? Are you realistic about what they're asking for?
I'm overly realistic.
Mm-hmm.
We live in a world now where people's expectations, rightly, because surgery has got better and better, are super, super high. We also live in a world of Instagram filters and pre-production editing and makeup and lighting. And no one is going to look perfect all the time. It is impossible. Even with the most perfect surgery, someone will take a picture of themselves that they don't like. This is entirely normal. So I would say my patients would say I'm very, very realistic. I say to all of my patients before surgery, I promise you two things. I will be brutally honest with you through the process, and I will do my best, but nothing else. You cannot give guarantees with surgery, but your expectation of outcome elevates with expertise, and your consistency outcome elevates too.
In your area of expertise, you were telling me there's been many changes. What have been the basic changes in the last, 15, 10 years in your area, basically?
God,
very briefly.
It's a very long question, but very briefly, I would say 5-6 years ago, I'd look at you and I'd give you the answer, nothing. Nothing really has changed. In the last 5 years, it's been like a rocket ship.
Wow. And
the biggest changes, I think, are collaboration and collegiality. Some of the best facelift surgeons in the world travel together. We speak to each other. We've become very good friends. We share concepts and ideas. And this is like 20 years of work in one, because people are coming together to share experience. And whilst there are negatives and positives to social media, one of the positives are this collaboration with WhatsApp groups, Telegram groups, things like this, where surgeons can come together and pool their expertise.
We were talking about facelift, for instance. In my way of thinking, this is something that especially a woman, but also a man does when they're starting to get old.
Male facelifting is increasing.
Exactly. But I think that's not the issue now. I mean, you can start earlier now, can't you? It makes sense to start early in some cases.
In some cases, absolutely. I think you don't offer to do someone's facelift based on the age in their passport. You operate to do the facelift based on the tissues in front of you. If they have excess laxity, excess skin, there's nothing but a facelift that's going to remove that.
So it could it be a person that's 18, 19?
No.
Or you could be...
No.
When does the tissues start to change?
So for me, the youngest facelift I've done is a young lady who was 28. But she had a reason for that. She had a car crash, she had maxillofacial fractures. I have a huge cohort, I have 36 patients with a rare premature skin laxity syndrome. I have 36 patients. We're currently writing them up. They're patients I'd operate on earlier. I wouldn't say the whole age of facelifting is becoming radically younger. I don't go out and I don't target any market, but I certainly don't target the younger demographic. But I wouldn't say no to a patient in their late 30s who needs a facelift, as long as they understand the risks of that.
You're saying before, you have to be honest about, of course, treatment.
Of course, always.
Do people understand all these things when you explain it to them? Because we have this strange relationship with aesthetic surgery, don't we? I mean, sometimes we ask the things that they're not possible. Sometimes maybe we ask the things that we really don't need, and we need the doctor to tell us that.
It comes down to communication, and it works both ways. You know, sometimes someone would ask you to do something that you think is going to look terrible. And I would rather not operate on someone, not take their money, than create ugly. So if I don't believe, and this is where I say you need a very solid taste and right brain to decide what's going to be attractive. If you don't think it's going to be attractive, don't do the surgery based on what the patient is asking you to do. And societal perception of beauty always shift and change. You've just got to look through history and art. You look at the Renaissance paintings, you go back further, you know, different faces used to be different, and they're more attractive depending on the period that we're in.
You were telling me before that men are also starting to have facelifts. Something has changed there during the last, 10 years maybe.
Yeah, men have always had facelifts. I think it's becoming more mainstream. I wrote an article on male facelifting, an invited article last year. Men don't want a facelift. Men are bothered by their neck. The neck starts to go. I never used to be able to do this, now I can. And it's annoying. And
I know exactly what you're talking about, yes.
They go skiing and they trap their neck in their helmet. Yeah, they're thinking about a facelift. So in men, they hate the word facelift. It's taboo. They worry they're going to look feminized. They're going to look strange. So in male facelifting, the anatomy is the same. There are subtle nuances that are different. You don't want to feminize a male face, but in men, it's all about the jawline and the neckline.
There's also something that also interests me a lot when you operate on someone, when you do surgery. The thing is, you really have to tell the difference, of course, because if you can't tell the difference, it doesn't make any sense. But at the same time, you have to keep it as natural as possible. Because you don't want people saying, oh, you've been operated on, I can sell that. But at the same time, you want to see the change in your face. So that's something you have to balance with at the same time.
The reason people look operated if they've had it, it's interesting. A lot of the people you look at in the magazines, they, you know, she's had a lot of work. Oftentimes they haven't had any surgery. They're overfilled, they've had non-surgical treatments and have overdone them. Because every patient's perspective, their baseline perspective changes. If someone has fillers put in the face, they never go back to completely empty of filler, then they have a little bit more and a little bit more. And like watching the grass grow, you don't notice. Suddenly it's too high or too full. With surgery, the reason surgery looks like surgery, the older techniques relied on tension. If you're putting tension in those tissues, they will come back and show it later on. And you get sweeping and asymmetries and strange pulled looks. One of the biggest shifts in the last 5 years in facelift surgery is the removal of all tension. The word lift, be it a brow, a lip, a neck, or a face, is no longer the case. It's not a lift, it's a reposition.
Talk to me a bit about eye surgery, because it's also very complicated to make changes in the eyes, at the same time keep them as natural as possible, natural looking as possible, no? What have been your achievements in this area?
So I wouldn't claim to be the world's greatest oculoplastic surgeon, but I do a lot of eyelid surgery in my practice as part of a comprehensive facial rejuvenation practice. I do the full gambit of oculoplastic procedures for cosmetic and aesthetic purposes. I think the small innovation that I've contributed to the field is to access the lower eyelid through the facelift approach, to improve the lower eyelids without actually doing an operation on the lower eyelids. And I've got some really promising results with that.
I was thinking also that sometimes it's obvious that you change the life of your patients, isn't it? I mean, I'm sure you have many experiences of people saying, "Doctor, thank you very much, you changed my life." What's your experience in that area, in that sense?
Yeah, it happens every week.
It happens every week?
It happens every week. And the key, as with everything, is selecting the right patient that's having the procedure for the right reasons. If someone is having a procedure because they want to change their life, that's an intangible the surgeon is not in control of. because you don't know what they want to change. You don't know what is making them unhappy, but you do a facelift and the facelift doesn't change their life, they're not happy with their facelift. Conversely, if someone who's got a relatively happy life, they're professionally successful, but something bothers them, they don't like how they look, and this could be insidious, it's in a photograph or a selfie that's taken, or there could be a family photo, or they catch a glimpse of themselves in the mirror. If you can remove that thing that bothers them, they get excited again. Their relationship with their face goes back to what it was before. They think less about it. They enjoy wearing makeup more. When we look good, we feel good. And if we feel good, we are more productive. People smile at us more. So I've seen patients have facelifts do better professionally. There's no guarantee with that, but I certainly have seen it.
And last, what would be your advice to someone who is thinking of having surgery on their face, eyes or facelift or whatever? The first thing you would tell them?
So the first thing I would tell them is this is a complex medical procedure that carries risk. How much does it bother you? If it's like, I'm thinking about it, I'm not sure, don't do it. If it's this really, I'm thinking about it more days than not, I miss how I used to look, I don't recognize myself in the mirror, I would then start researching the procedures. Results are everything. Results are everything. You can read all the marketing in the world, you can read all the glossy brochures and Instagram posts, but if you like a surgeon's aesthetic, you need to see hundreds of their results. You're looking for consistency, you're looking for taste. You look at the best facelift surgeons in the world, I will know who has done what facelift. Even though they're all beautiful facelifts, everybody has a signature look. So you need to look for that signature look. It becomes obvious when you start looking at someone's gallery of previous work. And then you've got to like the surgeon. This is teamwork. This is not an easy journey. It can be a very difficult 2 weeks, and then it can be 3 months before you've forgotten you've had a facelift. So you need to like the team, you've got to like your surgeon, you've got to have a good rapport, you've got to like their results. And when all of those are a tick, then you think about surgery.
Great. Dr. Bray, thank you very much.
My absolute pleasure.
Great, thanks.